Good morning, everyone, and happy Friday. It is Friday, May the 11th at around 12:30 noon. Feeling much better this week. The cold is gone. The leaves are beginning to bloom. Do leaves bloom? I'm not sure. Anyways, the leaves are coming out on the trees. Um, and I no longer am feeling cold, having a cold, or feeling cold. Anyways, I wanted to talk today a little bit about interprofessional collaborative mental health care. It's an area of research, it's an area of interest of mine, and as a counselor and therapist, I think it's important for us to know in terms of our case management. When do we need to access the support of other professionals in our care? And so, if you're in community agency, you're probably doing this more often than when you're in private practice. If you're working in a family health team or in a primary healthcare setting, you're hopefully probably doing this a lot more than people in private practice. But even those who are in private practice, I think it's really important to know when you need to have a conversation with your client about accessing other supports in their circles. And that might mean accessing services from their family doctor, having a referral for a psychiatric assessment, or even involving family members in the care or in the counseling, or even suggesting that individuals access integrative health, like, for example, acupuncture or naturopathic medicine or something like that. So while we would never say outright that this person needs to do something, we would always suggest that maybe it might be beneficial to their care. And so, as a clinician or a therapist or a counselor, however you conceptualize your professional identity, how do you know when the person would benefit from additional services? And I think a place to start from would be to look at their overall functioning, right? How is the person functioning within the context of your services? Are they improving with the service itself? Are they giving you feedback that they're able to complete the tasks that you've set out and collaborated to do together? Do you see that there's an improvement over time in therapy? Do they have the capacity to participate in therapy or in counseling? If the answer is yes, and they are participating and things are progressing, then you probably are okay to keep going with what you're doing if you're getting good feedback. However, if somebody comes to you and right from the first session you get this sense of, oh, they're probably not going to be able to partake in this therapy journey with me, or oh, they're probably not functioning very well. Like, for example, they're not able to go to work, or they've dropped out of school, or they've stopped caring for themselves. So they're having problems with daily activities of living. Then you can certainly engage with them in treatment or in the therapeutic process, but you also want to recommend that they go and talk to their doctor. And the reason why is because if you're dealing with someone that potentially has mental health symptoms, you want to make sure that they're treated optimally. And what we know about treatment of mental illness or other mental health conditions, that yes, skills are important, but sometimes people might require pills. And so, as my family doctor often says, um, it's not just pills, but skills. I would say from my end, it's not just skills, but sometimes one needs pills. And I think that that's a really difficult conversation for you to have with yourself as a therapist about what is my role in not recommending medication, because that's certainly not our scope of practice, but saying, you know what, maybe you might want to go and seek medical intervention, to sort of see if we can optimize your healing or tap into all the areas of recovery. And so that might be, the counselor or sorry, the client might say, oh, that's a really great idea. I was thinking about talking to my family doctor. I'm not sure if I should take medication or not, but I've always wondered what that's about. Certainly as a counselor, if you're trained in, psychotropic medication for non-medical providers, you could provide patient medication. That's certainly within our scope of practice. You wouldn't necessarily say, what they should take or what would be beneficial for them, but you can talk about the decision-making process that people have to partake when they come to think about medication, right? So we can be that support. The other role that we have is advocacy of mental health care with family doctors. So as either a person working in a community agency or a solo practitioner in private practice, you are a professional mental health provider, and you are within your rights to advocate for your patient, obviously with consent. Or now I'm calling it a patient. You can advocate on your client's behalf with their consent to express the person's need and also to explain the person's story. And what I know from working with clients or patients throughout the years is that often people will go to see a family doctor and, they'll feel pressured. They only have maybe 15 minutes to tell their story. Maybe they get white coat syndrome, so they see the doctor's, they see the authoritative stance of the doctor or the expert stance of the doctor, and so they don't necessarily know how to present themselves. What our role could be, or is, or should be, is that of presenting a client's story based on their self-report. So very often, you can call the family doctor, you can ask to speak to them. With consent, obviously, you can say, I've been working with such and such a client. They're presenting with these issues. You might have done some screeners, like, for example, the patient health questionnaire for depression or the generalized anxiety disorder questionnaire for GAD or generalized anxiety, or the PDSSR for the panic disorder screener. So you can talk to the family doctor in terms of what their levels of symptoms are. Are they experiencing increased anxiety symptoms? Are they experiencing increased depression? So you're essentially you're not diagnosing, but you're giving them the heads up about what the client's coming in presenting with. And then hopefully from that point, the client can then go and meet with the doctor, and the doctor can recommend a medication if that's something that they both decide. If the doctor is not available to speak one-on-one and you have client consent, you can write them a letter, right? And so writing them a letter saying that you've been working with this person, that potentially they might benefit from a psychiatric consultation or from a medical consultation to look at are there any other resources, which essentially means do you think this person might benefit from the medication? So I know it's a strange, if you're not medically oriented and you're working as a counselor or a social worker on your own, it might be sort of a strange situation to talk to patients about medication, but it might be something that you can do if you feel that your client or your patient is not functioning very well. And it's up to the person ultimately to decide whether or not they need medical support. But you want to use it as a resource, right? So, we have a lot of skills that we can give to individuals, and that's our resource. And then we need to know how to utilize other resources in terms of working interprofessionally, so between professionals, to optimize patient care. So I wanted to talk about that this week just because in my own practice, I'm trying to figure out, I've worked with family doctors in primary care for years, and I know how to do that within a clinic setting, but how do I know when my private clients need to access medical support? And essentially, I'm using the same skill, but I guess it would be just basically from an area of, functioning. Are they functioning well? Are they functioning well with just your treatment? If that's great, then keep doing it. If they're not, if it's not working, if they're not engaged, or if they're really having difficulty with daily activities of living, then certainly that's an indicator that you want to encourage them to access additional support, and you might have to facilitate a conversation with their family doctor. Again, always doing that with written consent from the client. Anyways, that was my topic today. Interprofessional collaborative mental health care. It's an area of practice that I have research experience in. My doctoral dissertation was on mental health counseling in family health teams. If you're working in a family health team and you'd like additional information and support about your role and how to best function within it, you can certainly give me a call. I'd be happy to support you. If you're working in private practice and you want some support with how do I talk to a family doctor and advocate for my client in terms of promoting their mental health, I'd love to hear about your experience and what's been working well for you. Again, if you want to contact me, you can do so on my website, paulineobrien.rp.com. I also have a Facebook page, Pauline O'Brien RP, or certainly you can call me in the old-fashioned way, and I'm happy to chat with anyone. As you know, I'm providing supervision services and consultation services. I also wanted to let you know about this other area that I have an expertise in, which is interprofessional collaborative mental health care. Anyways, feeling much better this week. Hope you guys are all too feeling wonderful in this springtime, almost hopefully summertime season. Have a great week, and we'll talk to you again.